Okay, so hello everyone. Today we're going to be speaking about the 6 facts about anxiety disorder in children that you probably didn't know. So before we start, I want to introduce myself very briefly. My name is Dr. Monica Gilbert. I am a licensed psychologist in the state of Florida, and I'm also a licensed mental health counselor, and I'm a board certified behavior analyst. And I have my private practice, Crystal Minds, which has been open for about 12 years already. And what we do is there is that we do behavior therapy for children with autism and other type of disorders, and sometimes kiddos that don't have a disorder, but just have some behavior difficulties. I also have a sister company, which is Crystal Mind Psychological Services. And here's where we do psychological evaluations. We do mental health treatment. So we do all those things. And my specialty is autism, but it's also ADHD and anxiety. And I've treated patients with anxiety. I've treated kids, adolescents, adults, and I myself, of course, have some anxiety. So I really like this topic because I think that with how things are going, nowadays, it's so prevalent, right? And we hear everyone talk about anxiety, right? Some of our kiddos come home and they talk about anxiety. I hear some of the parents saying, how can my kid have anxiety? Like, he's just a kid. Well, guess what? Your kids can have anxiety. So we're going to talk about all those things, and whatever questions you guys have, please put it in the chat. Okay. Alrighty. So let's get started. All right, so fact number 1 is that there are actually 7 types of anxiety disorder. Now, when we hear anxiety disorder, everyone really thinks about the generalized anxiety disorder, which we will go over, but there's actually 7 types. We're gonna go over all these 7 types of disorders very briefly in the 1 hour that we do have, except agoraphobia. Why? We just don't have time to go over agoraphobia, but agoraphobia is the fear of being in very open spaces and very closed spaces. And it usually happens more in adults, which is why I left it out. There are also anxiety disorders due to medical conditions and anxiety disorder due to substance use and abuse. So, what is an anxiety disorder? Anxiety disorder are disorders that share features of excessive fear and anxiety that can be related to some behavioral disturbances. So you see the behaviors manifested due to these anxiety disorders. Fear. So fear is an emotional response to real or imminent threat, and it is associated with surges of your autonomic nervous system and that flight or fight response, which we're going to talk a lot about that tonight. And then we have anxiety, which is the anticipation of that threat. And in anxiety, we have muscle tension, over hypervigilance, and it is all due in preparation for that dangerous situation that we're going to encounter. All right, so the reason why I wanted to go over those definitions is because most of the time, kids have excessive fear, right? And there is a difference between that excessive fear and excessive stress and an actual anxiety disorder. So the difference is that for anxiety disorder, it is really excessive beyond the child's developmental age. What does that mean? For example, if there's a child that fears going outside, right? Because he doesn't like the dark, right? Or he's 5 years old, 6 years old, that's probably typical, right? It's a typical behavior. However, if the child fears going outside every day because he thinks that he's going to, I don't know, like if there's going to be a tsunami or a really bad storm, then it can become a little pathological, right? And then it becomes a disorder. The other difference is that it differs from transient fear or stress by being persistent. So in order for someone to have an anxiety disorder, their symptoms must be present for at least 6 months or more. And also the disturbance causes clinical significant distress or impairment in social, academic, occupation, or other important areas of functioning. So the child is having poor grades when he used to have A's all the time, or the child doesn't want to go, to his friend's house because of this excessive fear, this excessive anxiety that he feels. So these are just some examples of how the anxiety can get in the way of life. And then that's when we start looking at the symptoms and give a diagnosis, right? So it is a myth that all children and everyone gets diagnosed with an anxiety disorder. It really depends if they meet most of these criteria. All right, so let me ask you guys this question. So if So before I go to the question, so there's a part of our brain that's called the amygdala, and the amygdala is this almond-shaped region that controls the fear, right? Like this is when you start feeling anxiety or you start feeling fear, you actually see some movements, right? Or some, some enlargement of this part of your brain, which is the amygdala. I have a little picture here so you guys can see a little diaphragm. So if you had this magic pill that you can just take, or you can give it to your loved one who's suffering from anxiety, that would completely take the amygdala away and would take away all this anxiety, would you take it? Put it in the chat. I want to hear your answers. Do you think that you would take this magic pill that would just make it go away? Okay, I see some yeses. Yes, yes. All right, so that really wouldn't be a good idea. And this is the reason why. Because if you came close to a bear, then you would not run away, right? So the amygdala and anxiety, in a way, it actually helps us with that fight or flight response. If we didn't have it, then we would freeze probably, and it wouldn't allow us to move forward. It wouldn't allow us to fight the bear or even get away from it. So this is usually how I explain anxiety to children and to others, because it's a very graphic and a good way of getting it, right? So what happens if you're jogging in the woods and all of a sudden you see a big grizzly bear? So when this happens, what really happens inside of your body is that your autonomic system goes into a sympathetic response. And in a sympathetic response, what tends to happen is that your pupils dilate, right? Because you want to make sure that you're running quicker. And this happens automatically. Like, it's not like you're telling your pupils to dilate. It just happens really automatically. It's fascinating. The second thing is that your saliva starts becoming inhibited. So you have this inhibition of saliva, because of course you don't need to eat if you're trying to get away from danger, right? It's not like you're going to run away from the bear with a sandwich or something. Also, your bladder gets constricted. So if you needed to go to the bathroom, you won't need to go to the bathroom anymore. Your blood starts pumping, your heart starts pumping, right? Because you need that blood in all of your extremities to run really quickly. And all these things start happening in your body. Again, this happens automatically. Now, when we do feel anxiety, right, is because we are perceiving this imagined threat in other circumstances of our life, right? So we see this threat of a bear in circumstances that are not really threatening. So for example, with social phobia, kids, or adults have this phobia when they have to perform, when they have to speak in public. So for them, it's like they're seeing that bear in that situation. And then automatically your body starts feeling those responses, the same responses you would feel if you were in front of a bear. So again, these responses are the fight and flight and freeze response that we hear about. And then the fawn response is something that has just, come to light. There's more research on it. And this is more for trauma responses, but it is also there. All right, so definitely you want your anxiety. I always tell people, if you have ever suffered from a panic disorder, from a panic attack, or from any type of anxiety disorder, it's really there to stay, right? The key is not to get rid of it. The key is to learn how to befriend it. Think about that anxiety like a roommate that's really annoying and takes all your food from the fridge when you don't want them to. So it's just learning how to put rules, and it's learning how to channel it so you can use it, right, for the things that you need it for, right? Like if you see a grizzly bear and you have to run and you have to fight or flight, and not let it get in the way of your life. Okay, so the first anxiety disorder is separation anxiety disorder. All right, so separation anxiety disorder is developmentally inappropriate and excessive fear or anxiety concerning separation from those who the individual is close to. It can be a caregiver, it can be a nanny, it can be a parent. And this person feels distress and anticipation or expressing separation, worry about losing the parent. Usually they worry about death, that parent dying or being kidnapped. I remember when I treated a client that came to Crystal Minds, and he came in, and the first few minutes, he didn't want to leave his mom's side. and he was very verbal. He was 7 years old. So I asked him, how come you don't want to leave your mom's side? He said, well, I think she's going to get kidnapped, right? And he knew it was irrational. Like, she was not going to get kidnapped in the middle of Doral. But still he had that fear. So we started working on him separating from her little by little, and then him using, different breathing techniques to relax until he was able to stay in a room while his mom was in a separate room. So it's also that refusal to leave the home without that parent, reluctant to be alone at home or in the community or sleep outside the home, and has repeated nightmares of the separation, and is also complains of physical symptoms when separated. So usually somatic symptoms, right? So vomiting, some diarrhea, some stomach aches when he's separated from that parent. And this has to last at least 4 weeks. And here you have a nice diagram that shows you what it would look like. So things to know about separation anxiety disorder is that it is prevalent in 0.9 to 1.9 of the population. The typical age of onset is younger than 12 years old. So usually kiddos start feeling these symptoms or start showing these behaviors when they are, under 12 years old. It is predominant both in females and in males in clinical samples, but more frequent in females in community samples. There's periods of exacerbations, which means that there are periods where it gets worse and then it gets better without treatment. And then usually this comes from parental overprotection. So you're going to see that a lot of anxiety disorders come from parents overprotecting their children. And we'll get to that in 1 minute. The heritability, so it's 73% heritability with other anxiety disorders. And usually people that have separation anxiety disorder display particular enhanced sensitivity to respiratory stimulation of CO2. All right, so fact number 3 is that adults can also have anxiety disorder, have separation anxiety disorder. So this doesn't happen very often. It's usually more often in children, but you will also see adults that have separation anxiety disorder and that meet the criteria. And if they meet the criteria and it gets in the way of their life, of course, they can also be diagnosed. So what is the treatment for separation anxiety disorder? So one of the common treatments for all the anxiety disorders is cognitive behavioral therapy. And the way that this works in terms of separation anxiety is that you want to help the child face and manage fears about separation. You want to provide psychoeducation for parents. So same thing we're doing here. This is psychoeducation. So educating parents so they understand that they shouldn't just, detach from the child, right? But that if they do it progressively and little by little, they can help them overcome this. So teach parents to not over reassure children. So a lot of the times what I see is that we practice our goodbyes. I teach parents how to practice their goodbyes. So when you say goodbye, it should be goodbye, I love you, and then you leave. Because if you continue to come back, then the child does not understand that concept. So practicing the goodbyes. Teach child coping skills to deal with the separation. And obviously, depending on whether they are verbal or not very verbal, have them express how they feel about the separation. Sometimes medication can be used in combination with CBT, and it may be helpful when the symptoms are severe. All right, so before we get to our second anxiety disorder, what questions do you have for me? You can put them here in the chat and I'll read them out loud. So what questions do you have about separation anxiety disorder? I'll give you guys about 2 minutes. If you don't have any questions, then I'll just move on. Okay, I got a question here. So how old can you be for separation anxiety disorder, the oldest age? So usually we see it more in little ones, right? So we see it in kids, but you can be older and have separation anxiety disorder. I mean, I've seen it, in people that I talk to, not really in a clinical sense, but, there's sometimes people that perhaps, they have they're a parent or a grandparent and their child goes to to college, right? And they start experiencing all these symptoms, right? And the symptoms are long lasting, and they have very catastrophic like dreams about the child dying or things like that, right? So I have heard about people, telling me stories that they're like that, but I have never really treated an adult with separation anxiety disorder. Any other questions? Okay, I have a question here. How is the child diagnosed? Okay, so the child would be diagnosed by going to a psychologist, a licensed mental health counselor. Sometimes pediatricians can diagnose as well, although I have my reservation with that. But usually if you take them to go see a psychologist based on the symptomology, based on what the psychologist tells you, and I mean, what you tell the psychologist and also the questions they ask, they're able to see if they meet the criteria for that disorder. You're welcome. So this is one of the, I guess disorders that you wouldn't really need like a full-on psychoeducational evaluation. I think if it's a clinician that understands what separation anxiety disorder is and anxiety disorders are in general, based on the symptoms, they're able to give you a correct diagnosis. Okay, I have another question. Could separation anxiety disorder be the cause for some people to find it hard to leave their significant other? Interesting. I've never ever thought about that, but yes, it may be the cause. If they meet the criteria, yes. That's a really good question. I always learn from you guys so much during these trainings. All right, so let's move on. And if you have any other questions, you can always ask me at the end, okay? All right, so let's talk about the second type of anxiety disorder, which is selective mutism. All right, so selective mutism is failure to speak in social settings despite speaking in other settings. It has to last for at least 1 month, and the disturbance interferes with educational or occupational achievement or with social communication. And you can probably see how that happens. If there's a child in a classroom who is not speaking up, the teacher might not grade them correctly, right? Or they may think that they're not understanding the concept. I had a client that I worked with that has selective mutism, and it was so severe that she was in the classroom and she would pee on herself just because she didn't want to speak and tell the teacher that she had to go to the bathroom, right? So it can become very impairing in some children when severe. The disturbance is not better explained by a communication disorder and does not occur exclusively during the course of autism spectrum disorder, schizophrenia, or another psychotic disorder. So you cannot diagnose these together in a way. Failure to speak is not attributed to lack of knowledge or comfort with spoken language. So those are things that you have to rule out before you give a diagnosis of selective mutism. So common symptoms of selective mutism is like lack of eye contact, clinging to parents, hiding, running away, crying, freezing, tantrum if asked to speak publicly, avoid initiating and participating in conversations, rely on gesture, nodding, pointing, and whispering. So these are some of the common features. Things to note is that it is relatively rare. It affects 1% of children. I've only worked with one child in my entire career. It usually occurs before age 5, and children tend to outgrow the disorder. It may result in social and academic impairment, and shaming the child for not speaking will increase the avoidance. So I see parents do this, right? And I'm Hispanic, so I can say this, right? But I remember growing up, and I didn't have selective mutism, but I was very shy, right? And what would my mom do? She would like push me and say, go talk, and in front of everyone. And that would just make it worse. It would exacerbate all of my symptoms of shyness. So definitely don't do that to your children. If they are a little shy, or if your child does have selective mutism. The etiology, so where does it come from? It may be due to a traumatic experience. This child that I worked with in Crystal Minds that had this disorder, her dad had passed away from a car crash. Familial links coupled with environmental factors such as reduced opportunities for social contact, observing anxious behaviors, or reinforcing avoidance behaviors may be attributed to it. and goodness of fit model, shy or timid temperament. So what does that mean? Usually the goodness of fit is a parent who is maybe overspoken, and then the child is shyer, right? Like sometimes there's not that fit or that match. And this can create more of this avoidance to speak out. Fact number 4 is that there is a clear difference between selective mutism and autism. So as I mentioned, they do share features like lack of eye contact, using gestures to communicate, not communicating in public. And sometimes I have parents where their child is diagnosed with autism spectrum disorder, because that's primarily what I work with. And then they've gone to someone else and they've gotten like a selective mutism diagnosis. Sometimes it's accurate, most of the time it isn't. The difference between both is that, for example, with autism, the communication tends to be the same, right? So if there's a non-communication or non-verbal communication, it's the same way in every setting. For children who have selective mutism, usually their communication is fine, right? So it's typical communication at home with people they're familiar with. However, when they go to settings where they don't know the person, or in school settings, that's where they just fail to speak. Also, another main difference is that children with autism spectrum disorder tend to engage in these repetitive behaviors. Selective mutism, they will not engage in these repetitive behaviors. However, you can have both diagnoses, like that can happen. Okay, so what is the treatment? So the treatment, again, like a lot of the anxiety disorder, is exposure-based practices. So the goal is for the child to say words in anxiety-provoking situations, right? So it's not like we're just throwing the child to an anxiety-provoking situation with no tools, but we're going to have them go into those situations little by little. So a shaping process. And we are replacing their anxious feelings or behaviors with more relaxed feelings. We're also increasing the child's feelings of independence by gradually improving his or her ability to speak in different situations. So when I worked with this child who came to my office, obviously I was a stranger, and she at first did not want to speak with me, which was completely okay. I did not force her. I did not say, come on, tell me this. And we did a lot of play therapy. We did it through play. And also, I would have her first point to things and then whisper, and then she would say like one word uteruses, right? So I would shape that so she felt more comfortable until she was able to speak with me. And then I generalized that to the school setting. Systematic desensitization involves the use of relaxation techniques along with gradual exposure to successively more anxiety-provoking situations. So we started in our office, for example, and then I had my office assistant at that time come in, and introduced herself, and then we started, integrating more people, and then we went to the school setting. Another behavioral treatment is stimulus fading, which involves gradually increasing exposure to a fear-invoking stimulus. So the number of people present in the room, which is the example that I just shared with you. And then positive reinforcement and shaping, right? So positive reinforcing those words towards what they want, with whatever it is that they want, whether it's attention or the actual object. So those things tend to work with this population. Some treatment for SLP options. So these are for some speech pathologists that also work with selective mutism. They can use the augmentative and alternative communication device, PECs, which are little picture cards. And these are different ways. I know we also use this when we work with children that are diagnosed with ASD. And you can also use it with selective mutism. Augmented self-modeling, so you're modeling different ways of interacting with others and the child. And then there's also DIR, which is sort of like this play therapy floor time mechanism. So before we go into our next anxiety disorder, any questions? Okay, see some questions here. Okay, so how do you cope with anxiety when you don't like balloons being popped and your nephew is here popping balloons? So this is actually a very interesting question. And it relates more to the phobia piece that we're going to speak about. But I worked with a child a couple of years ago. He was in the spectrum, so he was diagnosed with ASD, and he had a fear of balloons, right? So at some point in his life, that was paired, right, with something aversive, right? So either the sound was very loud or the impact of the balloon. And then, of course, he developed this phobia of balloons. And whenever they would go to like birthday parties, for example, his mom would like, take him away from balloons, which I don't know how she did that because there's balloons everywhere, but she would not expose him to balloons because he was afraid of it, right? Which made the fear worse. It made it stronger. So when we're talking about fears, which we're going to go over phobias, it's really important that we expose a child to those situations. Of course, there's certain situations that it doesn't really matter if they are fearful of, right? Like I'm completely fearful of roaches, but I can totally survive, right? It doesn't get into my life. But fear of balloons, imagine the child going to birthday parties, right? Like he couldn't go there, or if not, he would be put in a room where he was not exposed to balloons because of that fear. So any other questions with selective mutism? Really good question, thank you. No other questions? Okay, so I'll move on. But again, if you guys have questions, just put it in the chat. So my next disorder are specific phobias. So specific phobias are exactly what they sound like. So the difference between specific phobias and the other types of anxiety disorders is that usually with the other types of anxiety disorder, there's like this cognitive piece, right? Specific phobia is just it's more of this automatic piece, right? So it's not like you're thinking about it too much. It's sort of like an automatic reaction of your body. So specific phobia is marked fear about a specific object or situation. So there are tons of phobias. In children, the fear anxiety may be expressed through crying, through freezing, tantrums. So it is experienced differently than adults. The phobic stimulus is almost always provokes immediate fear, and you actively avoid it or you endure it with a lot of anxiety, right? So for example, going back to my example of the roaches, I am so fearful of roaches, right? One day I was teaching in the university and a roach came in, and of course I hyper focused and I saw it from across the hall, but I knew I had to keep my composure, right? So I didn't run out, which is what I would usually do, but then I endured it with a lot of anxiety, right? So I was sweating, my heart was palpitating, I forgot what I was saying. So a lot of the times that tends to happen as well. The phobic stimulus or the fear is out of proportion to the actual danger posed by the specific objects, right? So obviously, if you have like a lion in front of you or something big, right? I think typically a lot of people would feel fear. Or someone breaking into your house, right? But if it's something like a roach or something where you're not really put in a dangerous situation per se, then that's when it can become a phobia. The duration, again, like a lot of anxiety disorder, has to be 6 months or more. So you have to be experiencing these symptoms for 6 months or more. And the fear causes clinical significant distress or impairment in social occupation or other important areas of functioning. The example that I gave you about the balloons, right? This child was not able to play with his friends or, go to birthday parties because of the balloon situation, because he was fearful of balloons. All right, so there are different types of specific phobias. These are just some categories. So there's animal phobias, and there's so many animal phobias: natural environment, blood injection injury, and situational, and others. Really, there's a bunch of different types of phobias, every phobia you can imagine. Things to know about specific phobia is 7 to 9% of population experiences specific phobias. Typical age of onset is from 7 to 11 years old. And sometimes people tell me only 7 to 9% of the population. Well, these are the people that go into treatment, right? These are the people that actually seek treatment. Most of us that have a fear, we just deal with it or we go on with our lives, but we really don't go to see a therapist. That's the truth. Fear comes from the body's autonomic nervous system, which makes it difficult to treat, right? As I mentioned previously, your autonomic nervous system is like ready to just go, right? So it's not something that you control yourself per se. The etiology, so where does it come from? It can be a direct traumatic event with the phobic stimulus, or even observing others having, this fear or this situation with that phobic with that phobic stimulus. So for example, if you see someone faint because they have a needle phobia and that's your parents, you may develop a phobia of needles as well because you watch them faint. Individuals with blood injury phobia show unique propensity for vasovagal syncope, so fainting, right? People who do have blood injection phobia, which is phobia or fear of needles,
Hi.
faint. All right. And then children, as I mentioned previously, usually have overprotected parents. And this is very natural. If your child is fearful of something, you're going to try to keep them away from that phobic stimulus, right? First, because you don't want the tantrum and you don't want them to get scared either. So this is a natural response, I think, that every parent does. All right.
Hello there.
Fact number 5.
Yes, I know.
Fact number 5 is that phobias are more predominant in women than in men, except for blood injury phobia, for blood injection injury. So blood injection injury, which are needles, are more prevalent in males rather than females. Isn't that interesting? Okay, so what is the treatment for phobias? So usually the systematic desensitization is one of the most common treatments for phobias. So for example, if someone has a fear of flying, like I do, we would first teach the individual some breathing techniques. And then first we would, have them look at photos of planes while they're engaging in these breathing techniques, then watch a video of planes, then watch the real planes take off, then book a plane ticket, pack their flight, drive to the airport, check in for your flight, wait for boarding, get on the plane, and then take the flight. Obviously, this doesn't happen in one session. This happens progressively, and the individual becomes sort of like used to these conditions, and then they're able to then, like make their goal, which is taking the flight. So exposure therapy focuses on changing your responses to the objects or situation that you fear. So that gradual repeated exposure to the source of your specific phobia and the related thoughts, feelings, and sensations may help you learn to manage your anxiety. There's also medications, so beta blockers. Beta blockers block the stimulant effect of the adrenaline. So basically what it does, and the beta blockers are actually heart pressure blood pressure medication that is also used off-label sometimes for phobias and also for social anxiety disorder. So people that have to perform can take beta blockers, and it's not something that you take routinely. It's just something that you take before you are exposed to this phobic situation. So some people take it before they go on a flight. Some people do it before they have a performance. So this is something that is used very often. Sedatives, so when it's a little bit more severe, medications like benzos help you relax by reducing the amount of anxiety that you feel. All right, so I know this is a lot of information, but before we go into social anxiety disorder, which was previously called performance anxiety disorder, any questions? Okay, so I have a question here. Okay, so my son gets very anxious about the dismissal time at school every day. How can I help when I can't be there with him? So it really depends, right? It's important to identify what about the dismissal is making that child anxious, right? There's so many factors to it. So is it that, they don't like the sound of the bell, right? Like that happens sometimes with some kids who are who have this like hyposensitivity going on, right? Like children who are on the spectrum, for example. Also, like what happens after the bell, right? Is it a sensory thing, or is it more about the transitioning to another thing? Is it that anxiety as to, is my mom going to come and pick me up? Or do I fear that something is catastrophic, something bad is going to happen to her, right? So it really depends. We need to identify and speak to the child and ask them what the fear is, if they're able to tell us, so we can know which type of anxiety it is and then treat it that way. Can you give an example of treatments for a kid that is extremely scared of bees? So scared of bees. So first, it depends, I would ask you if it is something that you feel needs to get treated, right? Like, is it getting in the way of his life, right? Is it getting in the way of him having fun, of him enjoying his activities because of this fear of bees? Secondly, okay, it is. Okay. All right. So, it's really hard to deal, for example, with that situation per se, because you wouldn't ultimately expose the child to the actual bee, because he can get, it can really sting him. So the fear in a way is rational. However, the behaviors that he engages, the behaviors that he engages in, does someone want to speak? Okay, I thought I heard someone. All right. So the behaviors that he engages in are the ones that you can treat, right? So if he has a tantrum, whatever he sees a bee, well, we can teach a child to say, can I move somewhere else? Can I get away from here because the bees are there? Okay, he doesn't even want to look at pictures or videos of bees. Okay, so it may be severe. So I would recommend that you seek a therapist that really focuses on phobias to help him treat that, because it isn't something that you would just treat from one day to the other, right? Something that would be used, an example, I'm not saying that this is directly for your child, but an example of something that can be used is the same example that I shared about the airplane, right? So we would, kind of first provide the child a picture of a bee or of that insect, and then, reinforce him for staring at it for like, I don't know, 2 seconds, right? And then kind of increment the amount of time that he's able to look at that picture. And then little by little, start with the next steps. Yes, is that something that I'm able to teach? He was my patient, yes. So contact me after this training and we can definitely chat. So my forte are not phobias, but I have treated some phobias before, or if not, I can recommend you to someone that can help, definitely. But thank you for that question. All right, so any other questions about phobias? And I'm sure a lot of you didn't think that phobias were part of anxiety disorders, right? And they're very similar in the symptomology and in the heart palpitation and all those other symptoms that we feel with all the other anxiety disorders. All right, so let's get to social anxiety disorder, SAD. Social anxiety disorder used to be called performance anxiety, as I mentioned, and this is a fear or anxiety about one or more social situations where the individual is exposed to scrutiny by others. So others are criticizing you or are watching you in some way. And this can be having conversations with others, meeting unfamiliar people, being observed eating in public, and performing in front of others. The individual usually fears that he or she will act in a way that will be negatively evaluated. So they're going to be humiliated or embarrassed. People are going to laugh at them. They're not going to want to be their friends anymore. They're going to take their jobs away. The individual is concerned that he or she will be judged as anxious, weak, crazy, stupid, boring, intimidating, dirty, or unlikable. In children, the fear anxiety may be expressed by crying, tantrums, freezing, clinging, shrinking, or failing to speak in social situations. The social situations are avoided or endured with intense fear or anxiety. And again, it has to last for at least 6 months. So I had a client that I worked with a couple years ago, and his social anxiety was so severe. I mean, he was great. Like he had, great speech and he communicated very well, but he had very severe social anxiety disorder to the point where we did an IQ test in him and he was gifted, but because he didn't respond in classes, he would freeze. They didn't put him in gifted classes, and he was actually failing in some of his classes. And it was so severe that I remember that he told me the story of one time of when he went through Starbucks and he froze. Like he was in Starbucks and they asked him, what do you want to drink or what do you want to order? And he completely froze in his car and he just left, right? So that's how severe it was. It was really getting in the way of his life. Some common situations that, again, are avoided are, as I said, interacting with strangers, groups of people, attending school in vivo, attending parties or social gatherings, initiating conversations, dating, making eye contact, entering a room when it's already full or people are seated, going to a store and eating in front of others, and using the public restroom. I think I already mentioned eating in front of others, but that's a very common one you see. Okay, things to know, the prevalence is 7%. So it happens in 7% of the population. It's more prevalent in males due to the social expectation, right? So usually if it happens in females, females don't have that social expectation or that social demand that you have to speak in public and be that leader, right? So if women, females, if they have social anxiety, it goes undetected. However, if males have it, then that's when parents tend to worry. That's when they take them, to go see a psychologist. So that's why you see that it's more prevalent in males. It's not really because they have it more. It's just that they get treated more. So 13 years old is the median age of onset. So this is the age where it tends to start. Onset may follow a stressful or humiliating experience. So being bullied, vomiting during a public speech. The heritability, except for performance-only anxiety. So there is a high heritability. And then people have found that there is an overreactive amygdala, right? So the amygdala, that almond-shaped little part of your brain, tends to be overreactive in people with social anxiety disorder. What are the treatments? You probably guessed it. Exposure therapy. So you expose the person to the fear situation, and then you gradually teach them appropriate teaching techniques, right? So in this situation, the fear situation is being in front of people, performing. So one thing that I would, work on with my clients is, instead, something that would really bother him or would get him super anxious to the point where his stomach started hurting, is that, the teacher would do like a random pick, right? So the teacher would say something like, okay, now you're going to answer this question, or you're going to answer the question, right? So we worked on him actually initiating. So him standing up and saying, can I answer the question, right? Because if you already get it over with, then you don't have that fear of being picked on. So those are just like one of the many techniques that we worked on. And of course, him going to Starbucks, him ordering his whatever it is that he wanted while he was practicing his breathing techniques. There's also medication, antidepressants, anxiolytics, beta blockers. So a lot of people actually take these beta blockers, believe it or not, when they're about to speak in public, and it does work. It's very effective. All right, so let's go into panic disorders. Before we get to panic disorders, any questions about social anxiety disorder? Any questions about social anxiety disorder?
I had a question, Dr. Monica. Hi, good evening. I had a son, he's 14 years old. He's doing like leadership and debate clubs, but sometimes I believe he can do a little more, like being in panels and speaking, but he is constantly think how the friend's gonna look if he's in school. So this is a very complicated age. So do you have any tips for teenagers that suffering from anxiety, but focus more in this phobia, that what others gonna say if this seems to be nice in front of others?
So can I ask you, what do you usually respond to him when he asks you that? Or when he tells you that others are speaking to him or telling him that? So what's your response usually when he tells you, well, other kids are telling me this, or they're speaking to me this way?
When I ask him about that, he not say the kids is looking at him. I believe sometimes he just put it more in his mind, and he think more the others gonna see him look cool, because I not think no response from other kids. Instead, his friends or others encourage him to do. But I don't know, sometimes I just feel like he putting his focus more in what others approve,
right,
rather than just using his skills and capability to speak in public, for example.
Gotcha. Yeah, so so I can't give you a direct advice or suggestion on that, but I can speak in very general terms, right? So one thing to keep in mind is that you mentioned it in the beginning. He's in a very weird age, right? Like these adolescent age. So a lot of it is typical. People, for the most part, don't like to speak in public. So there is a difference between that normal fear of just speaking in public and then that social anxiety, right? Which I'm so glad that you bring that up. Because the social anxiety is truly impairing in that it doesn't allow them to move forward, right? And they start feeling these somatic symptoms, right? So their stomach hurts and all these other somatic symptoms. So there is a difference between it being an anxiety disorder and just like a normal adolescent kind of things, right? Also in adolescence, I mean, let's remember that they are growing up and their bodies are changing and, they look like a child who's like an adult. So it's like a really weird, period in their life and of course parents' lives as well. So they're going through a lot of transitions. So if you feel like it's more of like this social anxiety where it's truly impairing his abilities to meet academic demands, of making friends, and it really gets in the way of his life in that way, then maybe you can take him to a psychologist to get treatment. And maybe it's just something that is transient, right? Maybe it's just something that he is feeling now. I think all adolescents think that, they're the kind of like centerpiece of attention and all eyes are on them. I think we've all gone through those weird, years where it's just natural that they feel like that, right? That everyone is looking at you and everyone is doing that. Something that I tell my adolescents when I work with them is I'm very realistic with them. And I'm like, they're not really paying attention to you. Like you think everyone like in this world is just like looking at you. They're not, right? They're looking at them. They're worried about how they look. They're worried about this. They're worried about that. And just speaking to them very realistically, right? Sometimes as parents, we tend to sugarcoat things and make it perfect. And, oh, but you're such a nice person and everyone's going to like you. I tend to like being more like realistic, right? Everyone is not going to like you. The majority of people have their own things going on. And a great percentage of people you're just not going to click with them. And that's absolutely okay. But I would say just being very realistic with them and very, very, very to the point, I think is really important. More so when you're speaking with adolescents, because they already feel like they're adults trapped in this kind of child's body. So I hope that helped. Definitely, if you have any other questions, let me know. All right, so let's move on. If you guys have any questions, put it on the chat. Please keep the questions coming. This is what you're saying is probably what another parent is feeling and doesn't want to say, so keep them coming. All right, so panic disorders. So panic disorders are recurrent unexpected panic attacks. And a panic attack is an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes. You have to have these 4 symptoms in order to get diagnosed with a panic disorder. And usually what happens is that when you have your first panic attack, it's a panic attack because I'm going to go through the symptoms now. But then the reoccurring panic attacks are just that fear of having that first panic attack, right? Is that anticipation of having that first panic attack. So usually people will tell you, or usually people will not want to drive in a car for a very long time because they say, oh my gosh, if I have a panic attack, how am I going to go to the hospital or where am I going to go, right? Or even going on an airplane. I had a friend that she, suffered from panic attacks, and whenever we would go somewhere, she would always look for the hospital. She would always say, well, where's the nearest hospital in case I have to go there? So some of the symptoms are shortness of breath, palpitation, pounding heart, sweating, trembling, shaking, feeling dizzy, unsteady, lightheaded, nausea, abdominal pain, chest pain or discomfort, feeling like you're choking, heat sensations, paresthesia, which is where you feel like you have a million little ants in your body, derealization or depersonalization, like you don't know where you are or who you are at that time, fear of losing control or going crazy, and fear of dying. So these are some of the, most common symptoms. Usually they go to emergency rooms because they feel like they're having a heart attack, right? And it's not really a heart attack. So these are just some of the symptoms of panic disorders. So things to know about panic disorder. It occurs in 2 to 3% of the population. Females are more often affected than males. Gradual increase after age 14 and a peak in adulthood. Negatively affectivity and anxiety sensitivity. So usually these are people that see the world a little bit more negative for the most part, but they're more sensitive to anxiety for whatever reason, biological or just their neurotransmitters. There is a clear stressor, but it may be difficult to pinpoint. So there's always a stressor. There's always a thought that provokes this other thought that then goes into starting to feel these symptoms of a panic attack. And then you have that fear of, oh my gosh, I'm going to go into that panic attack. Children who experience sexual physical abuse may be more prone to panic disorders. Respiratory disturbances such as asthma is also associated with panic disorders. So what are some of the treatments for panic disorder? So CBT, again, gradual recreate the symptoms of the panic attack in a safe, repetitive manner. Once the physical sensations of the panic no longer feel threatening, the attacks begin to resolve. Identifying triggers to panic and learning to diffuse them. So learn that physiological symptoms subside. So a lot of the times when I've worked with, and I have worked with a couple of people that suffer with panic disorder. So some of the times, and some of the people, what I've told them is just write it out, right? Like just write it out. Normalize that you are having these sensations. And I know it's easier said than done, but really just normalize that, oh, here we go again, another panic attack. And just know that you're going to have these, palpitations and all these things, but then, then they will subside, right? Because again, what makes the panic attack worse is when you start thinking, oh my gosh, I'm going to have a panic attack, and you start working yourself up, in other words, and you start breathing differently. And that's what provokes the panic attack, again, the severity of it. There's medication. So there's SSRIs, SNRIs, there's benzos, of course, for all the anxiety disorders, you can take benzos for most of them. So sometimes patients take medication, sometimes they just do therapy, sometimes a combination of both. Usually, once you have your first panic attack, you're always going to be prone to having panic attacks. But I've had clients that haven't had panic attacks for years. And then one day they may, have that panic attack again. Another good treatment, which I didn't list here, is exercising, right? So remember, all of this has to do with your autonomic nervous system and your palpitations and your breathing and all those techniques, right? So imagine, going to the gym and actually running or doing something like that, where you have control of your respiratory system, where you have control of your heart, right? So that helps you psychologically, but it also really helps you, within your body. So physiologically, it helps you get more control of your breathing, and then you can, help yourself when you are having that panic attack. And children also get panic attacks, by the way. Maybe they communicate it differently. Like I've had children that tell me, I feel like something is squeezing my heart, or I have like an elephant on top of me squeezing me and I can't breathe and my heart is running. I feel like my heart is running. I had a child tell me. All right, so before we get to our last anxiety disorder, which is generalized anxiety disorder, any questions about panic disorders? No questions. Should I move on? All right, so I'm going to move on. Again, if you have questions, you can put in the chat. So our last disorder is generalized anxiety disorder. Again, when you think about anxiety disorder, it is this, GAD, which is generalized anxiety disorder. And in order to get a diagnosis of this, you need 3 or more of the following symptoms. One for children, and it has to occur for at least 6 months in duration. And some of these symptoms is that restlessness, or feeling keyed up or on edge, being easily fatigued, difficulty concentrating, or mind going blank. So some children, may come in, for example, I've had kids come in for testing because they have poor concentration, and parents and teachers think that perhaps they have like an attention problem, like ADHD or something. And in reality, it's anxiety, right? It's the anxiety that they're feeling that is provoking this difficulty in the way that they are concentrating. Irritability. So usually we don't associate irritability with anxiety, but it is part of anxiety. Usually that's how males tend to behave when they do have anxiety, just because it's socialized that way. But females definitely can also feel like this. Muscle tension. So sometimes they'll endure certain situations, and afterwards they feel like they just their muscles and their joints and everything hurts. And obviously with time, there have been studies that have linked severe anxiety with like RA and different, other like autoimmune diseases actually. Sleep disturbances, so difficulty falling asleep or staying asleep, or restless, unsatisfying sleep. So this reminds me of this meme that I saw, which was this person sleeping, and then all of a sudden they open their eyes like this and they're like, where's my birth certificate? You guys have probably seen it. But it's something like that, right? Like your mind is always on the go. And you find it very difficult to control the worry. Usually people say very unhelpful things. Like I've heard people say like, well, just don't be anxious about it, or just don't worry about it. If people with anxiety had the ability to do that, I think they would choose to do that. But sometimes it's just very difficult to do that. All right, so fact number 6 is that children tend to worry about catastrophic events. So when it comes to GAD, they tend to be overly conforming or perfectionistic kids. They tend to seek constant reassurance, and females are more likely to receive the diagnosis. GAD symptoms in children may look like anger, difficulty sleeping, some defiance, lack of focus or concentration, and avoidance. Remember that a lot of the times kids don't have the verbal capacity that we adults have. So they will manifest it with behaviors. That is their way of communicating how they think or what they feel. Now, I do want to say that it doesn't mean that we're just going to allow, tantrums or physical aggression or all these bad behaviors, but we can teach them appropriate ways of expressing how they feel, and not really having to engage in those behaviors. I do want to kind of point that out. So this is just a diagram that I use with my kiddos because, again, kiddos are not able to tell you, like certain feelings that they have. So I always like to use pictures, and I like to ask them, where do you feel your anxiety, or where do you feel this heat or this motion or whatever, right? Is it in the head area? Is it in the mouth area, in your throat, in your chest, in your stomach, or in your legs, right? And depending on what they say, you're able to see all these symptoms of the anxiety disorder, right? And this makes perfect sense with what I had told you previously, which is that autonomic system, right? Coming back, that sympathetic nervous system, where if we see a bear, these things start happening, right? Eyes start dilating so you can see, and get away from there. So that can provoke dizziness, headaches, sleep difficulties, nightmares, that hyper focus. Mouth area, so it inhibits your salivation, so you have dry mouth, you tend to bite your cheeks, nail biting, overeating, sometimes vomiting because of the stomach. So these are different things that are associated with it. All right, treatment, physical activity, including cardio. Again, this is a great treatment for any type of anxiety disorder. Relaxation techniques such as progressive muscle relaxation and deep breathing techniques tend to also help, although those can be a little tricky. So, just really doing it the correct way is important. It's not just like breathing for the sake of it. That doesn't do anything. Mindfulness tends to help. So a lot of like that meditation, mindfulness. I myself prefer cardio over mindfulness, but it really depends on what your preference is. There's this CBT book, which I really like. I always forget to put the book here, but I will post it on my stories if you guys follow me on Instagram. And it's called Bully. I think it's Bully in the Brain. I want to make sure I'll post the book there so you can see. You can get it on Amazon. But this is one of the therapeutic books that I work on with my kids at Crystal Minds. And it helps them identify negative thoughts, challenge or dispute these irrational thoughts, and replace them with more realistic ones. And as I mentioned, if you've ever had anxiety is there to stay. So it's like that really, annoying roommate. So it's important to build some type of relationship with your anxiety, right? And I know that sounds super weird. Like, why would you want to build a relationship with the anxiety? But as I told you, it's there to stay, right? So you don't want to like go against it so much, because then it makes it bigger. So it's really finding a way to channel it. Anxiety helps us sometimes. It helps us to not procrastinate. It helps us to kind of get away from these bad situations. And what I always tell people is, if you're feeling anxiety, ask yourself why. Maybe what you're currently doing is not congruent with what you really want to do. And that's why you're feeling anxiety, right? And I tell my kids that all the time as well. Treatment, I always get the question, should I medicate my child? Should I, don't medicate your child, take them to a child psychiatrist that knows what they're doing. But there are medications out there, antidepressants, work for anxiety, buspirone, anxiolytics, benzos, all these work for anxiety disorders. So any questions that you have with anxiety disorder? I see some questions coming in now. Okay, I have a question. Let me see. Thank you so much. You're welcome. Is it safe to say that anxiety can lead to a panic attack? So a panic attack is a type of anxiety. So yes, so the panic attack is a type of anxiety. Okay, another question, general question. Our children get aggressive when we tell them to get off of their electronic devices. We usually be firm and stand our ground and with them, but it always is a combative situation. How can we as parents get our kids to get off their devices without it leading to an argument? Okay, so that is more of a, well, you said a general question. That is more of a behavioral question. I can't tell you specifically what to do, but there are, different techniques. I know that electronics are a big thing, and truly they're a big thing because they're reinforcing to both people, right? They're reinforcing to the child who's watching or engaging in the electronic, and let's be honest, they're a little reinforcing to the parent as well, because you get your alone time, you get your relaxed time. I know how to have kids. I have two of my own, but there are different behavior techniques that you can use. There's just not just one, and it really depends on your situation. So I can't tell you directly what to do, but I'll be posting some things later on about that, so you can get some ideas. Definitely, if any of you suspect that your child has an anxiety disorder, please take them to see a psychologist, but more importantly, a psychologist or a therapist that really, that this is their niche, right? That this is what they do, because there's a lot of psychologists out there, but it's impossible for them to be competent in every area. So really important that you find a psychologist that is competent in the area that you are looking for, that is an expert in that area where you're suspecting your child is having those difficulties. You're welcome. Any other questions about anxiety disorders? And again, you guys can locate me on Instagram. I'm very active. In my Crystal Minds page, I put more, suggestions and things for parents, newsletters. I'll always, I am sending once a month a newsletter on different topics. This month was anxiety. Next month will be a different topic. And I'll be doing a couple more of these free webinars. Hopefully you guys enjoyed it and you liked it, but I'll stay on for a couple more minutes just in case you have questions. You can also unmute yourself and speak into the mic. Don't be shy. We're all falling asleep and exhausted at this time anyways. Do you have a psychologist in your practice that can start sessions with my child due to cold hands or sweating hands? Yes, so you can contact me. If you go into my Instagram, I will send you the information to get started. We do take we take all types of major private insurances, private pay. We just don't work with Medicaid. With everything else, we tend to take it, yes. Oh, you're welcome. I'm glad you liked it. Thank you for attending, you guys. I'm glad you enjoyed it. You're welcome. All right, so I'm gonna stop the recording, but I'll hang out for a couple of minutes.